Good afternoon, everybody. I'm very sorry to have held you up. I was sat at the back going, this session's starting late, where's the chair? And then somebody told me it was me, so I do apologise. So without me wittering on for much longer, I came actually to listen to Kim and Kath specifically. So I'd like to welcome Kim Wilde up to the stage to talk about text messaging up in Scotland. Yeah, Scotland? North of England. Yeah, northwest. Northwest England, thank you.
Okay. Hi everyone, my name's, Kim Wilde. Well, Kimberly really, but most people call me Kim. My background is actually podiatry, but at the moment I've been seconded into the lead in the wound care pathway. So I'm doing a lot of work around developing a self-management pathway for wounds, and that's where the innovation of text messaging comes in. I'm going to talk about that a little bit more, and then at the end of the presentation I'm going to actually do a case study of a patient which is actually podiatry related, but it's got an interesting video that I'm going to share with you. Okay, so a little bit about Pennine Care. So we used to just be a mental health provider, but now I think for about the past 4 years we've actually had community services as well. We deliver in 6 out of 10 boroughs across Greater Manchester, so that's Bury, Haywood, Middleton, Rochdale, Oldham and Trafford. So we've got covering a large population of 1.3 million there, and we've got approximately 5,500 staff and delivering 263 different services and about 2.5 million patient contacts last year. So our strategy is that we want to embed self-care and self-management into every service we deliver. So that's quite a big ask. Wound care is probably one of the biggest areas because obviously it covers quite a lot of different disciplines with it, podiatry, nursing, so obviously treatment room. There's also children's nursing and mental health as well. Other services that we are piloting at the minute, particularly related to district nursing, is eye drops, anticoagulant injections, and we're also looking at possibly doing something with insulin as well. So we're really trying to push forward with the self-management. So, a little bit, this has probably been talked about a lot, a little bit about the prevalence of wounds. So, estimated to be about 2.2 million patients with a wound in the UK. And obviously we've got an increase in ageing population and a reduced workforce. So we need to start thinking a little bit differently about how we manage patients. So the cost of managing wounds in the UK is estimated between 4.5 to 5 billion per year. So that's 4% of the total NHS budget, and 66% of those costs are incurred in the community. And the majority of the spend is actually on healthcare professional time, and wound dressings only account for 14% of the total spend. So why self-managed wounds? There's lots and lots of evidence around long-term conditions such as diabetes and self-management there, so like things like the expert programme, there's lots of stuff around physio and things like that. Very, very little around wound care. I think there's probably about 6 to 7 papers, and none of that has been done in the UK. And I can only say that self-management wound care may have the potential to improve the following. So improved outcomes for staff and patients, less strain on resources, patient empowerment and changes in healthcare usage. There is some evidence to say that patients that do self-manage don't have to spend as much time with the NHS. And roughly, normal patients will only actually spend about 3 hours a year within the NHS, so they're actually self-managing the rest of that time. Has anyone heard of Flow? Or does anybody use it? No? Nobody at all? Okay, so Flow is a health technology that can be used to support self-management. So it provides improved health literacy, it increases patient confidence and competence, and it provides remote support and contact with the clinical team. So why text messaging and why Flow? So most people have always got the mobile in their hands, haven't they? So they're familiar with that technology, and I think even more ageing patients still actually use mobiles as well. There's no significant requirement for upfront cost while building local evidence base, and it's been evidenced to support self-management and improve outcomes. There's flexibility of the product to meet locally identified needs, so it can be used in different ways. It can be used literally just to send the patient a text message. You can send flow information like blood pressures, blood sugar readings. It can ask patients a question and they can text back. So there's lots of different ways that it can be used. And it has been tried and tested in NHS provider organisations. So if you Google it and go onto the Florence website, you can see the different organisations that are currently using it. So, Flow text messaging, it's nationally recognised, it's NHS owned, and it's a developed self-management tool designed to improve clinical outcomes by improving patients' adherence to clinical guidance. And there's quite a lot of evaluation and good practice publications. So if you wanted to have a little bit of read round on the evidence, there's some there listed there. So here's some examples of how we currently use it for wound care. You can use as many text messages as you want. So there's an example of 4 here. So we would sign a patient up to self-management. So they would still be seeing the clinician, but they'd be doing some shared care. And we would then text them at 9 o'clock to say, hi, this is Flo. This is a reminder to change your dressing. Then we'd text them a little bit later on saying, okay, is your wound getting any bigger? Is it smelling? If it is, that might be a sign of infection, so contact your local health team, or if you've got a named practitioner. And then again, another one again at 9:30, saying don't forget if your wound is getting wetter or the dressing's changed colour, etc. Again, you would contact for help. And again, another text message saying if your wound is more painful and hot or swollen, please ring the number because this might be a sign of infection. Some of the staff that we've rolled this out with didn't like the 4 text messages. And some of them wanted all that information into 2. So again, that can be played around with a little bit, and you can meet what the service needs are. So some services will have it to how they suit them. What happens is that the staff are signed up before they go live with the self-management pathway, and they make the decision around the text messaging. It takes less than a minute to sign your patient up to Flow. So it's quite quick, because I think a lot of the staff are quite conscious that they don't have a lot of time in clinics, but everything's set up before, and you literally just put the patient's mobile number in, the name, and you just sign them up to, there'll be a few things that they've already decided, you just sign it up to daily dressings, alternate days, whatever the department's decided that they want. Where this really came from, we had a wound care self-management pilot back in 2015, and this has actually been published, this paper. And it was a pilot that was done in Haywood, Middleton and Rochdale with, I think it was about 4 district nurses. And they again used the Flow telehealth, and they signed up, I think, 18 patients. And the outcomes were that it was very, very popular with staff, the patients liked it, the clinical outcomes were good, the healing rates were within what we would expect. Nobody rang up with a problem. So from that, we decided to roll it out further to all of the boroughs. It was a lady called Caroline Poole that actually did that paper, so if you wanted to have a read of that, it's very, very interesting. And that kind of gave us some positive feedback to start rolling this out to the other boroughs. So, the aim of our wound care pathway redesign, so for my job, was to develop a robust self-management pathway in wound care across Pennine Care Foundation Trust's adult community nursing services, and to optimise and evidence quality outcomes. So what the project has done is it's involved 4 stages. So initially I researched all the current evidence and practice, which I found was quite minimal. There was a few papers out there, and obviously the one that Caroline had done, but a lot of it was done abroad, particularly a little bit of work that was done in Australia. The next bit, designing a pathway with support from the key stakeholders such as patients, nursing teams and governance, that's took probably about 7 months. So that was getting a working group together, developing the protocol, which took a long time to decide what wounds to include, to include all the flow pathway, also looking at a patient leaflet as well. So we designed a patient leaflet that's gone round to patients to have a look at. It's been tweaked a lot, but the hardest thing that we found was doing a capacity evaluation. So okay, you assess your wound and you think, yeah, the wound can be self-managed, but how do you know that patient or that patient's carer can actually have the capacity to self-manage that wound? That was the biggest and most difficult piece of work, and we got it down to one A4 sheet of paper. and a tick box, so again it was easy for the nurses to use. And again, that was piloted, and it has had a few tweaks since the first draft. The other thing that we've done as well is we've got a website called My Health, My Community, and that's got lots and lots of patient information there. So we've done a video as well, around a basic video around skincare, the different stages of wound healing, what wound infection might look like, and we've also in the process of doing a video of actually running through how to change the dressing. And the leaflet's also got really, really good pictures on. So if patients don't read very well and just like to see something visual, it's got really good visual pictures on. So the pathway is to be embedded in all services that provide wound care. So we've just embedded it into a treatment room service in Oldham, and we've had from January 34 patients signed up. We're actually rolling it out to a district nurse team in Bury in May, and I'm not sure whether I'm going to get different results with that, whether they're going to have more chronic wounds that probably can't be self-managed. So that'll be interesting when some of that evaluation comes in. And the project's also going to be supported by a master's research dissertation, which I'm doing, to increase the evidence base around self-management, so kind of to give us a bit of evidence around what we're doing. So what I'm doing with that is I'm going to interview 12 patients around what their perceptions of self-management are in wound care. So is this a good idea? Do they think self-management is a positive idea around wound care? And just get a little bit of feel really to what patients think, and get a little bit of information around how the wounds affect them around the daily living, hygiene and things like that. So I'm quite excited about that piece of work, because I'm hoping it'll sit quite nicely with the project. So I'm going to talk about a team that has embedded flow, and I've done really, really well with it. So that's the podiatry team in Oldham. So here's some of the challenges as a team that they have. Their patients have missed opportunities of preventing ulceration. They find that the patients have got a lot of information to take on board in clinic. They might be depressed, they might have other things on their mind, and you're talking to them and it's not going in. And patients with diabetes, vascular disease can often be in denial, and they're frightened. You know, they've had infections before, they might have had a previous amputation, and they're quite fearful. They might have a misunderstanding and a miscomprehension of diagnosis and prognosis. And staff are always frustrated when an ulceration ends up turning into an amputation. And an increase in diabetic patients and a reduction in budget has meant that it's very, very difficult to manage these patients. So what they thought when they introduced flow, they thought it was brilliant because they could reinforce their education and remind the patients that they've got 2 feet and they need to be looking at them regularly. They decided on very short, meaningful messages, so it was things like, have you checked your feet today? Have you creamed your feet? What to look for if there was any breaks in the skin? And they've had really, really early success, so I think that's really motivated the staff to carry on using flow. And we'll come on to a video in a minute which shows that it's giving patient empowerment. And the early presentation has led to reduction in foot complications, so because patients are actually self-managing better, they're noticing things quicker and they're presenting quicker at clinic. There's been a reduction of foot complications, so it's led to a reduction in anxiety, depression and loss of work, because obviously a lot of our patients that have had diabetic foot ulcers are still working. And also, it's almost giving the stopping the staff from carrying the burdens around of worrying about that patient, because we do, don't we? The patient walks out the door and you think they've not listened to anything I've said, and they're going to end up back here in 4 weeks' time with a problem. One of the other things that we did to support the staff around self-management was send them all on motivational interview training. So they've all had a bit of an introduction to self-management by thinking differently with a short training session that I do, but they've also had a full day of motivational interview training. I don't know if anyone in the audience has had that, but that actually gives you almost the permission to give the monkey back to the patient. So say, actually, this is your wound, these are your feet. And it gives you really, really good techniques around language and what to look for when patients are talking that you can actually pull out that's positive and work on that. So I'd recommend that training to anybody who's thinking about doing some self-management. Okay, so we're going to have a video from, it's a gentleman called Shane. He's male, he's over 45 years. He's always presenting late, so he presents when the problem's there. He's had numerous hospital admissions, he's had IV antibiotics, and he actually consented to flow at a routine check. So we're just going to have that video, please.
When we heard about the flow system, we were quite excited as part of the podiatry team, because a lot of our patients, we have problems getting them into clinic at the right time. They tend to come in when that problem is too severe. With Flow, what we wanted to do, and which we've managed to do, is to reinforce the education and the message. So as soon as you find a problem with your feet, come into us and see whether we can prevent that getting any worse.
Before I used the Flow system, I tended to neglect my feet, let's be perfectly honest. What happened was, I wouldn't check them as often as I needed to do. Yeah, I would get foot ulcers, the time it would take to come in, it'd be maybe 5 or 6 appointments, spread out over maybe 2 or 3 months. So what I really wanted to do is to try and stop that, and I've combat having to have all this treatment on my feet. When I heard about the fact that Flow was available, I thought, well, this is exactly what I was looking for, to manage my own feet. The big difference that I've found by using Flow is that by the fact it's regularly asking me to check, and I'm checking that my feet are okay, that if the slightest thing comes up that I'm worried about, I can give the ICC a call, whip in, just check it, make sure everything's all right. And I know that I'm not going to get into a situation where I get ulcers and have to have more time off, and that's it. I want my feet to be here a lot longer than could possibly end up with diabetes. So,
although it's in its infancy, it's already proved its success, and we wish to continue that.
Okay, so our learning so far. So Flow can support services to think differently about supporting self-management and patient empowerment, and it can support service users to engage more fully in their care and rehabilitation. Bespoke nature of Flow allows a targeted approach, so obviously different departments can use it differently. And outcomes to date have shown positive patient experience and acceptance of improved clinical outcomes. And it's popular with the clinicians, they like it. I think initially there is that little bit of a fear of how much time it's going to take to sign a patient up, but once they've had the training and they feel quite confident and they see the outcomes, it's really, really shown its benefit. And confidence breeds innovation and creativity. So they're the key things really, in that, you know, that is the plan for Pennine Care is to really promote self-management, obviously by using the innovation. Any questions?
Thank you, Kim. That's really, really interesting. Does anybody have any questions for Kim? Oh, yeah, there's a few out there.
There's a few, okay.
Have we got a roaming mic or the throwy ball? Oh, it's coming.
Yep.
So we've got one just here.
This one.
Yeah.
Hi there, Kim.
Hi.
That was a really fantastic presentation.
Thank you.
So much. I bet you're really proud of what you've achieved. So I work in the acute services in your locality. So as a tissue viability nurse, how do I access that service? Because we might be able to identify patients in hospital that might be perfect for this. So what would be the process?
That is one of the key things that's come up every single time when I've done the training. How do we get that culture change into secondary care? So I think maybe with us just making a link, that would be really, really good, and having some networking and some discussions, because I think it has to be a culture change everywhere, doesn't it? But if you can be identifying the patients and having those conversations in the hospital, that would be fantastic. So yeah, definitely we could do some shared working. That would be brilliant.
Thank you.
I'll come and
I'll
grab
speak
you.
to you.
Una, Dr. Bull at the back.
Throw it. Thank you, very interesting. I wondered, how important is it that the patient knows the possible carers so they get buy-in, so that you haven't lost that personal touch about the person looking after you? That's one thing. And the other thing is, have you shown to see whether you've got evidence of actual learning to behaviour change, or is it just a constant reminder?
The only thing that we're actually we're evaluating patient experience and staff experience. So from the patient experience, we're looking at has their knowledge around their wound increased? Do they feel more educated? We're also looking at wound healing rates as well and service utilisation. And I suppose some of that will come out in my dissertation as well around, the thing is we don't know whether patients like the concept of self-management.
Sorry, can I ask another one? It was just yesterday we had a patient who had a rather difficult experience with a leg ulcer.
Yeah.
And I mean, my experience being, it's really hard to persuade some patients to do the care. Mm-hmm. And this gentleman was saying if only he'd been told before. And,
yeah.
And I think our experience being that some patients do listen to us and some don't to the
That's where
debate. And I think, it's quite interesting how we approach that, the more preventive side of work.
Yeah, I think that's where the motivational interviewing comes into play, the skills that the staff are going to learn there. But there will always be some patients that have got low patient activation that will not embrace self-management, and those are the ones that we're just going to have to not involve in the pathway. And there is going to be a number of that, but it may be, okay, what is affecting their motivation to self-manage? Is there anything we can do there? Is it a psychological problem? Is it social isolation? So we talk a lot about that in the training and how we can support that patient to become more motivated to self-manage. But that has come up quite a lot. Did I answer your question a bit there? I mean, I think I'll know more when I've done a bit more of the evaluation on patient numbers and done a few more case studies. Obviously that was quite a positive one with that patient, but we will have some negative ones as well, probably.
Lovely. Thank you, Kim.
Okay, thanks. Thank you.